Hello everyone, welcome to part 1 of anatomy series in which we are going to target the bones of the upper limb. To start with, let's look into the clavicle. This is a quick revision. So clavicle is a long bone that lies horizontally. It's the only long bone that lies horizontally. It has no medullary cavity. It's the only bone to ossify first. It's the only long bone that has two primary centers of ossification. Clavicle, in Latin, it means small key. The functions of clavicle is it supports the shoulder. It helps in swinging the arm. It transmits weight. Of upper limb to the axial skeleton. Very quickly, let's look into the side determination. Clavicle is divisible into two parts. The first one is the lateral 1/3. The second one is the medial 2/3. Laterally, we have the acromial end, which articulates with the acromion process of the scapula to form the acromioclavicular joint. Medially, we have the sternal end, which articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. It extends inferiorly to articulate with the first costal cartilage. Quickly, let's look into the shaft. The shaft is divided into two parts. The lateral 1/3 and the medial 2/3. So, the lateral 1/3, which is flat, it has two borders and two surfaces. For the borders, anteriorly, it is concave. Posteriorly, it is convex. The two surfaces are superior and inferior. Superior, it is subcutaneous. The inferior part has elevations. One is the conoid elevation, conoid tubercle, and the trapezoid ridge. Both of which form coracoclavicular ligament. Now, the function of the coracoclavicular ligament is that it transmits weight of upper limb to the axial skeleton. For the medial 2/3, which is rounded, it has four surfaces. It is divided into four parts. Anteriorly, it is convex. It's convex. And posteriorly, it is concave. Superiorly, it is rough. Medially, and on the inferior part, on the medial end, it is rough, and on the lateral end, it has a subclavian groove and the nutrient foramen. I'll write it down here again. Inferior, you have the subclavian groove, and the nutrient foramen. So here we have the trapezoid ridge, and here we have the conoid tubercle. Right here, we have the subclavian groove. Let's quickly look into the attachments. On the top, we have the trapezius muscle. Not to forget, this is the lateral end. This is the medial end. So, one above, one below, we have the deltoid. So laterally we have the shoulder, and one of the main muscles of the shoulder is the deltoid. Again, one above, one below, medially, we have the pectoralis major. Now, again, one above and one below. Both are this is the sternocleidomastoid muscle, and we have the sternohyoid. The green portion indicates the ligaments. So here we have the trapezoid ridge and conoid tubercle of the coraco-clavicular ligament, clavicular ligament, and right here we have the costoclavicular ligament. Here, as said, we have the subclavian groove, so by default we have the subclavius muscle. The blue one, always in anatomy, is the insertion, and the red one is the origin, and the green one is for the ligaments. Lastly, let's look into ossification. So the clavicle has two primary centers of ossification. It has two primary centers of ossification. It is the first bone to ossify. And the two primary centers appear in the shaft between the 5th to 6th weeks of intrauterine life, and they complete at about 45th day. The secondary center at the medial end appears at about 15 to 17 years and complete at about 21 to 22 years. Occasionally, there is a secondary center at the acromial end. Let's look into the clinical anatomy. The clavicle is commonly fractured, falling on outstretched hand. And the most common site of fracture is junction between the two curves. The common site of fracture is in the between of two curves, due to which one end moves downwards and one end moves upwards. So because there is a pull downwards of the deltoid, and the trapezius pulls it upwards. The second condition is a congenital condition in which the clavicle is congenitally absent or imperfectly developed. It is called cladocranial dysostosis, which I said is congenital, in which the clavicle is either absent or imperfectly developed. What happens in this condition is that the shoulders droop and can be approximated anteriorly in front of the chest. So that's all about the clavicle, and let's meet in another video in which we're going to discuss the other bones.